Understanding attention deficit, hyperactivity disorder, ADHD, causes, signs, symptoms, and treatment. Attention deficit, hyperactivity disorder, ADHD, is a neurodevelopmental disorder commonly diagnosed in children but often continuing into adulthood. It is characterized by patterns of inattention, hyperactivity, and impulsivity that interfere with functioning or development. Here's a comprehensive look at the causes, signs, symptoms, and treatment options for ADHD. Causes of ADHD. 1. Genetic factors. Family history. ADHD tends to run in families, suggesting a genetic component. Genetic mutations. Specific genes related to the neurotransmitter dopamine are often implicated. 2. Brain structure and function. Neurotransmitter imbalances. Differences in dopamine and norepinephrine levels. Brain structure. Variations in brain regions that control attention and impulse control. Brain development. Delays or differences in brain maturation. 3. Environmental factors. Prenatal exposure. Smoking, alcohol use, and drug use during pregnancy. Premature birth. Being born prematurely or with low birth weight. Lead exposure. Exposure to lead, particularly in early childhood. 4. Social factors. Family dynamics. High levels of family stress, conflict, or dysfunction. Early childhood trauma. Exposure to traumatic events or severe neglect. Signs and symptoms. 1. Inattention. Difficulty sustaining attention. Challenges with maintaining focus on tasks or play activities. Careless mistakes. Frequent mistakes due to inattention to details. Not listening. Appearing not to listen when spoken to directly. Lack of follow-through. Difficulty following through on instructions and completing tasks. Disorganization. Poor organizational skills. Losing items necessary for tasks. Avoiding tasks. Avoidance of tasks that require sustained mental effort. Forgetfulness. Forgetting daily activities and routines. 2. Hyperactivity. Fidgeting. Constant fidgeting or tapping hands or feet. Inability to stay seated. Difficulty remaining seated in situations where it is expected. Inappropriate running or climbing. Engaging in such behaviors when not appropriate. Inability to play quietly. Difficulty engaging in quiet activities. Excessive talking. Talking excessively without consideration of others. 3. Impulsivity. Blurting out answers. Interrupting or blurting out answers before questions are completed. Difficulty waiting. Trouble waiting for their turn in activities or conversations. Interrupting others. Frequently interrupting or intruding on others' conversations or games. Treatment. 1. Behavioral therapy. Behavioral interventions. Techniques to increase positive behaviors and decrease problematic ones. Parent training. Educating parents on strategies to support their child's behavior. Classroom interventions. Structured classroom environments and behavioral interventions. 2. Medication. Stimulants. Medications like methylphenidate, Ritalin, and amphetamine-based drugs, Adderall, that increase dopamine and norepinephrine levels. Non-stimulants. Atomoxetine, Strattera, guanfacine, Intuniv, and clonidine, Cape, are alternatives for those who do not respond to stimulants. 3. Educational support. Individualized education plans, IEPs, customized educational plans for students with ADHD. 4. Psychotherapy. Cognitive behavioral therapy, CBT, helps individuals with ADHD to change negative thought patterns and behaviors. Social skills training. Teaching social skills to improve interactions with peers. 5. Lifestyle modifications. Regular exercise. Physical activity to help manage symptoms. Healthy diet. A balanced diet to support overall health and well-being. Sleep hygiene. Establishing routines to ensure adequate sleep. Attention deficit, hyperactivity disorder, ADHD, is a complex neurodevelopmental disorder that affects both children and adults. Recognizing the causes, identifying the signs and symptoms, and exploring the various treatment options are essential for managing ADHD effectively. Comprehensive care, including behavioral interventions, medication, educational support, and lifestyle modifications, can significantly improve the quality of life for those with ADHD. Stay informed and proactive in addressing ADHD to achieve the best possible outcomes.